According to the 2025 Hypertension Canada Primary Care Guideline, what is the recommended blood pressure treatment target for adults with hypertension? Option A, 140/90 mmHg for all adults with hypertension. Option B, systolic BP, 130 mmHg with no specific diastolic target. Option C, 130 to 80 mmHg for all adults, replacing the old 140/90 general target. Option D, systolic BP, 120 mmHg per the Sprint intensive control arm. Option E, 135/80 mmHg, based on equivalence with home BP monitoring thresholds. Correct answer is B, systolic BP, 130 mmHg, with no specific diastolic target. The 2025 Hypertension Canada Guideline eliminated the older risk-stratified target system entirely in favor of one simplified, universal target. Systolic BP, 130 mmHg for essentially all adults with hypertension, provided treatment is well tolerated. Deliberately, no specific diastolic target is set. The Guideline Committee cited evidence that adults with systolic BP 130 mmHg carry relatively low cardiovascular risk even when diastolic BP runs 70 to 90 mmHg. This single-target approach was adopted explicitly for simplicity and ease of implementation in primary care, replacing the prior two-tier 140/90 general, 130/80 high-risk system. If you chose a different option, feel free to pause here and review the comments for each answer and the study recommendation below. BF is a 38-year-old woman who has been on fluoxetine 20 milligrams daily for 8 weeks for depression. Her psychiatrist decides to switch her to phenelzine, MAOI. What is the minimum washout period required before phenelzine can be safely initiated? Option A, 24 hours. Option B, 2 weeks. Option C, 4 weeks. Option D, no washout needed if starting at a low dose. Option E, 5 weeks. Correct answer is E, 5 weeks. Fluoxetine has an extremely long half-life. 1 to 6 days for fluoxetine. 4 to 16 days for its active metabolite norfluoxetine. Before switching from fluoxetine to an MAOI, a washout period of at least 5 weeks, approximately 5 half-lives of norfluoxetine, is required to prevent serotonin syndrome, a potentially life-threatening condition characterized by hyperthermia, rigidity, myoclonus, autonomic instability, and altered mental status. For other SSRIs, SNRIs, the washout before starting MAOI is 14 days. If you chose a different option, feel free to pause here and review the comments for each answer and the study recommendation below. A patient asks the pharmacist where she can purchase Plan B, levonorgestrel 1.5 mg. Emergency contraception. Under the NAPRA National Drug Scheduling System, Plan B is classified as Option A, unscheduled, can be sold anywhere, including non-pharmacy outlets with no pharmacist involvement required. Option B, unscheduled, available off-shelf in any retail setting without mandatory pharmacist intervention. Option C, Schedule I, requires a prescription from a physician or nurse practitioner. Option D, Schedule II, must be stored behind the pharmacy counter with mandatory pharmacist involvement before dispensing. Option E, Schedule III, located in pharmacy self-selection area. Pharmacist accessible but not required. Correct answer is E, Schedule 3, located in pharmacy self-selection area. Pharmacist accessible but not required. Levonorgestrel is Schedule 2 when sold generally, but NAPRA carves out a specific exception for the single 1.5 mg dose emergency contraception product, Plan B and generics. That specific formulation and package size is classified as Schedule 3, not unscheduled. Schedule 3 means the product is located in the pharmacy's self-selection area, where a pharmacist must be accessible on the premises but is not required to directly intervene in the sale. This still restricts sale to a pharmacy setting, unlike a true unscheduled product, which could be sold at any retail outlet, while allowing the patient to self-select the product without mandatory pharmacist counseling. If you chose a different option, feel free to pause here and review the comments for each answer and the study recommendation below. The pharmacist is conducting an annual medication review for YM. The care coordinator reports that YM has experienced 2 unwitnessed falls in the past month and exhibits morning drowsiness. Which pair of medications represents the highest priority targets for deprescribing? Option A, donepezil and metoprolol. Option B, lorazepam and pantoprazole. Option C, furosemide and donepezil. Option D, calcium carbonate and furosemide. Option E, donepezil and calcium carbonate. Correct answer is B, lorazepam and pantoprazole. Lorazepam is a high-risk benzodiazepine, Beers stop criteria. The directly contributes to daytime sedation and falls in the elderly. Pantoprazole lacks an ongoing indication. GI bleed was 4 years ago with no recurrence or concurrent high-risk therapy, and carries long-term risks. C. difficile, fractures, hypomagnesemia. If you chose a different option, feel free to pause here and review the comments for each answer and the study recommendation below. Which beta blocker is relatively preferred if one must be used in a patient with mild asthma? Option A, propranolol. Option B, carvedilol. Option C, bisoprolol. Option D, sotalol. Option E, timolol. Correct answer is C, bisoprolol. Cardioselective beta-1 blockers, bisoprolol, metoprolol, atenolol, preferentially block cardiac beta-1 receptors and have less bronchospastic effect than non-selective beta blockers, propranolol, carvedilol. Beta blockers should generally be avoided in asthma, but if essential, cardioselective agents are preferred with monitoring. If you chose a different option, feel free to pause here and review the comments for each answer and the study recommendation below. Docet.ca, Pharmacy Exam Preparation Platform. Boost your knowledge before exam day.